Thank you so very much for joining us today for our day-long event entitled From Segregation to Integration.
When it comes to Americans receiving equal access to quality health care, the U.S. government says,
our boss is every American who depends on us. Those families who are just looking for a fair shot and who want to build futures without having to worry about discrimination or prejudice. That's who we're working for every day.
That mission and motivation gained strong momentum 50 years ago during the Civil Rights Movement. You see, up until that point,
it is less well known that hospitals were segregated, wards divided by race. It is less well known that the blood supply, even in that period, was segregated.
There was unequal resource allocation between black and white facilities. There was, because of this, and diminished access to health care for African Americans.
But landmark legislation in the form of the 1964 Civil Rights Act would end segregation. Soon after, the U.S. government began enforcing its new law.
This is how we worked in those days. We didn't have computers, and this is carbon paper, for those of you who don't know.
John Wodach was a young civil servant who crisscrossed the country enforcing Title VI, a section of the Civil Rights Act that bars federal funding of segregated agencies.
There was a sense of those of us who were coming to Washington to work that we could change this circumstance.
One of his most memorable cases occurred at a segregated nursing home in Northern California. At the time, the business was receiving federal funds.
We had a hearing, won the hearing, they didn't appeal, and we actually terminated federal financial assistance because we were seeking not only relief for that hospital, but all Oddfellow hospitals in the United States. That one hospital eventually wrote a letter to us saying, we're losing $6,000 a month in federal funding, you've got to change this. And we said, well, no, you have to change what you're doing.
Another assignment sent him to Mississippi, where
there was an ad for a white doctor who was going to get get staff privileges at the county hospital. So we got involved, sent a letter, and changed that.
But one of his most haunting cases occurred in Alabama.
To this day, I still have nightmares about the investigation I did.
Wodach was investigating an all-black mental hospital. He says conditions were deplorable, and the building hadn't been renovated in decades.
The chains were still there. I first went into a room that had probably 300 to 400 beds in it, a person in each bed. The metal sides pulled up, they were really chained in those beds with 2 people tending them. So we were dealing with a very dire situation. We did eventually integrate that and improve the services.
Wodach retired as a high-ranking director at the Department of Justice, but he fondly remembers fighting for equal health care, a mission leaving a legacy that's inspiring current civil servants.
Making sure that all of us have equal opportunity to obtain those building blocks that lead to healthy and productive lives. The work that so many people do at this department to close the disparities in health care and expand access to affordable care is a civil rights issue.